So what would you say? Let's start at 30s. Like some things that women can be doing, like best things that we should be doing for
The
our health.
number one thing, I think every single girl who wants to have a family in the future needs to know her egg count, period. And I would start that way early. At 18, everyone needs to have a baseline egg count. Everyone needs to have a baseline pelvic ultrasound. And their symptoms should be addressed. Painful periods, even in a 14-year-old, is not okay. Acne, hair loss, facial hair, body hair, weight gain, irregular period is not okay in a 15-year-old. That's probably PCOS.
It's so good to know because it's like irregular periods we were just told our whole life, like, ugh, just having a really bad period. Like, what can you, it's like, I get a heating pad and take some Tylenol, you know?
And, periods can have pain with it. But if you're staying home, if you're ending up in the emergency room, if you're calling your mom to pick you up from school, if you go to your doctor and you say my periods are painful, those are all red flags. If you have some cramps, you take 2 Advils and you're done and you go on with your life, that's okay. But it cannot affect your life socially. If it does, that's not normal. PCOS needs to be addressed. Eating disorder in teenagers need to be addressed. Their egg count needs to be checked. Hormones need to be checked. So that's just your baseline, right?
Lifetime risk of breast cancer.
But that's older. That's older.
That's older. So that's like 20. Yeah, because I just had my fertility doctor on and she was just saying how she tells people not to get so nervous about it and that if their periods are regular to try. Like I was saying, how young should you start freezing your eggs? Like if you know.
So it depends, right? I have a patient at 15. I'm freezing her egg.
No way, because her egg quality and number is low.
So you cannot test egg quality on any blood test or ultrasound, but we can look at egg count. You can do that by doing an ultrasound and maybe checking follicles, or you can do a blood test. You don't need to panic and check a egg count in a 15-year-old. But if that 15-year-old is having very painful periods, she ends up in the emergency room, she can't function, her mom is bringing you to the office, you better check that egg count. I have a patient I recently saw maybe a month ago. She's 14 years old. Her egg count is her AMH, anti-Mullerian hormone, is a blood test. Her egg count is 0.8. It's the egg count of a 40-year-old. Had I not been her doctor, she would have never been able to have children.
Was it endometriosis?
Probably. I'm doing a full workup as far as you have to do chromosomal analysis. You have to look for other causes. But I'm freezing her eggs.
These are teenagers that came in with other symptoms.
So if you have a teenager who has normal periods, they have a little bit of acne here and there, you don't have to panic and bring them in. But I would say at 18, I would love to have a baseline egg count because you don't know how many eggs.
It's a simple blood test.
It's a simple blood test. Why not do it? One of our assistants, after listening to our podcast, went to her doctor in Los Angeles and said, I listened to this podcast. I'm 24 years old. I've never done my egg count. Can you do a blood test? Her gynecologist said, absolutely not. It's malpractice to do an egg count in a 24-year-old. You're fine.
That's not true, right?
That's not true. That's what I'm saying. And I'm bringing it up here.
Right. I'm like making sure. But it's like when a doctor tells you that something's
if she
malpractice.
hadn't been listening to the podcast, she would think that was fine.
So I would say 3 years before first intercourse or age 21 is the first time you start doing pap smears. If you're sexually active and you're young, you start doing your STDs every single year, even if you're 15 years old and you're sexually active. Every teenager needs to be screened for PCOS, for endometriosis, and very importantly, mothers, if you're listening to this podcast, please screen your children for PMDD.